computer. So let us start all over again now that we're recording. And let me put this off. So welcome to Shifa Holistic Healthcare, the center where we train and where we treat. A little about Shifa Holistic Healthcare Center. At Shifa Holistic Healthcare, we treat using Islamic medicine, traditional African medicine, traditional Chinese medicine, and Ayurvedic medicine. We use parts of Unani medicine too. This combination gives us an edge over a lot of other centers where treatments are done. We also train at Shifa Holistic Healthcare. We train for traditional African medical science. We train for Hijama cupping therapy. We train TCM, acupuncture, and we train for dry needling. We also have some special programs we run for self-development or improvement that we do. So these programs we run once or twice a year for the diploma and the advanced diploma, while special programs we do. And we try to question here. Let me just make sure. We'll be having small breaks or small distractions when people come into the class like that. But it's all part of today is the first day. So we're trying to go through the basics, and we'll be setting ground rules too on how we're going to run this program, inshallah. So like I said, we train and we treat. We train and we treat. And this makes it easy for us. We give support to our students. We offer a various number of courses, and these courses are all certified. You see, we have you can sit down here. We have a certification from the International Practitioners for Holistic Medicine, which is based in the UK. That body regulates and credits and verifies qualifications of holistic practitioners around the world. And their certificates are valid in over 120 countries, all Commonwealth countries, so to speak. The certificates are accepted, and so our certificates are so weighted. Here too, we are recognized as an NSQF training center by the National Board for Technical Education, which means we can train people and prepare them for NSQF certification. For those who don't know what the NSQF is, it's National Skills Qualification Framework, which is a program that has been set up to verify and assess and certify skills that people have in various fields that have so far been captured. We have been captured in the traditional African medical science and the TCAM, that traditional complementary and alternative medicine. We've been captured there as a skill. So we train people for this certification. The NSQF certification starts from level 1 to level 9. Level 1, which is your basic certificates and things like that, while level 5 is your ND, level 6 is your BSc or your HND, level 7 is your PGD, Level 8 is your master's, and level 9 is your PhD. So from this, based on your prior learning, you can be graded and given a certificate that is nationally accepted. So it is a very weighted certificate you get after this program. The program, like you've seen in the flyers, is 6 months for the Hijama copying diploma, 6 months for traditional medical science, level 1 and 2, and 6 months for the advanced learning diplomas. Now, these courses have been divided into 3 parts. You have those who want to do the traditional hijama only, those who want to do the traditional medical science only, and those who want to combine the two. We prefer where you combine the two because it gives you an edge and it tells you how to go further, because once you practice cupping therapy, hijama, as in hijama or cupping therapy, you need to give some medication to your patients. You have to know how you go about it and why you give them those things. You know your limitations and what you can and cannot do and why you should and shouldn't do. Now, having said all this, a lot of questions have been asked about the program, especially as relate the weight, which I've explained now on certification, as relates to the payments. We started off with an early bird entry, and the early bird was up to today where we've started class. So you find out that from today, people who join in might have to pay full fees for the program. We would look into possible discounts here and there, but as for payments, we accept a broken down payment system where the patient pays, the student, pays in part, and 2 parts preferably. We did this to make it available and accessible for everybody under the current conditions and financial constraints in the country. Now, having said this, the program runs 6 months to 9 months. The program has, I'll go through all that very soon when we start our slides. The program has assignments, tests, and some exams. It has a practical component to it. Now, this practical component involves coming into the class here at the facility we have in Kaduna. For those who have certain backgrounds, we could do online supervised assessments for them. But that is a special arrangement because we prefer to see what you can do and how you can do. The primary reason behind this is we try to build a base where we can refer patients to our students. Referring patients to your students means you take responsibility for whatever that therapist does. So we need to be sure you have trained, you understand, and you're doing it the way we want you to. So that when we send a patient to you wherever you are in the country, for those in Lagos, they say so, and those who we have sent to in Abuja too, you find out that we need to be confident that we will be giving the best to the patient and we will not have any reason for worry. So I'll be going on to some slides and I'll be answering questions as we go through on with the program. Share sound. Share. For those who are monitoring on Facebook, you would be seeing the slides, while those who are monitoring on TikTok might not see the slides, but the video will be available for this particular video, for this particular class we have. So, like I said, the slideshow from the beginning. So it's a diploma program in cupping therapy and traditional medical science, and a combined course for it. And like we say, there's a need to learn, a need to know, a need to understand, and a need to do the right thing. Where you're doing health, it's very important that you pay attention to life quality, life care, the patient's comfort, and all that. So, like we say, half a doctor is a danger to your life, just like half a scholar is a danger to your faith. You need to know what you're doing. You need to understand how you're doing it and why you're doing it. So that is why you need to learn. That is why you need to keep learning. And that is why you need to keep upgrading yourself. So when we're talking about cupping therapy has been used for thousands of years, but it has gained popularity again now because people have realized it's non-invasive. And you find a lot of sports people doing it now because there's no doping, no drugs involved. It helps revive the body, the organs, the immune system, the lymphatic system. It does a whole lot of things. So there's a need to understand it if you're going to be a therapist, to be able to defend everything you do. Like I said, I'll be answering questions as we go along. Now, what are the questions? One of the questions that has come up is, how will this class be run? It's online, like you can see, and it's offline. We have some people in class, and the idea is to make it flexible. The videos for each class will be put on the Telegram group for you to watch at your own convenience. And while we're putting these videos in the Telegram group for your convenience, you would be able to pick it up. A lot of us in the class right now are practitioners and those who want to learn, who have other professions. So you find out you might not be able to be in class now at 11, like we've started today, but you would get the video in the group. You would watch it, you will make your notes, and where assignments or end of module tests are given, you'll be expected to answer them and send in for assessment. These are weighted programs, and like I said, we're trying to key it in, and we have gone so far on it to the NSQF assessment so that you will be able to get a certificate that is government approved, that is weighted by the federal government of Nigeria, and it makes you recognized. It gives you that license to practice, unlike those who don't. And this, very soon, the laws will be in effect. The council will be set, maybe passed this year, also by this particular Senate, for the Council for Traditional and Complementary and Alternative Medicine. Once that comes in, there will be a need to regulate, to be licensed and co. So that will affect your practice. And like I said, Hijama therapy, what will this course give you? It will give you knowledge of Hijama from the Sunnah point of view. It will introduce you to the Sunnah points, the Hijama points, treating various ailments with Hijama and abiding to various set ethical procedures, rules, and regulations of the profession. We'll look into certain cures that have come in from 1,400 years ago that Hadith has carried, and now science is verifying those things and agreeing with them. We will look at parts of Dua Ruqiyya, as it's called. That is when we're looking at Hijama itself as Hijama. When we're looking at it as cupping therapy, we will be looking at it from the Chinese point of view, the traditional Chinese medicine point of view. There's a slight difference between both of them, which you will see as we go on. And this difference is in the spiritual link that Hijama has that cupping therapy doesn't have. Hijama is seen as a sunnah. So if you take it like that, it's a part of worship. The Muslims will understand this. And cupping therapy has been around too, from records during the biblical times, from records that we have. So it has been there, and you will see it's a treatment that has come. It is a medical procedure, whether you see it as a sunnah or something that anybody can buy cups and just make incisions and take body out. It is a medical procedure and should be treated as such. And to practice it, you need to have knowledge. So you don't cause pain or deformity on your patient. You need to understand why you should or shouldn't, when you should or shouldn't, how you should or shouldn't, and what you should be able to do or not do. You should be able to defend it, because sooner or later, as we progress, you're going to soon be faced with litigations. Some patients might not be happy, and we would prefer to mediate, but then you could face that thing where somebody wants to blame your cupping for his ailment going bad or something that he might have done. So you need to be able to know what you're doing and defend it, and why you should or not do, how you take care of everything, and your legal aspects of it, the professional clinic part of it, the therapy part of it, the post, the pre, all of it. You need to know this, and this is why this training is very important. Now, like I said, this training is a 6-month program for those who are doing Hijama cupping therapy only, or the traditional medical science only, while those who are doing the combined course is for 9 months, and they have a more weighted certificate than those who do the single ones. Each month is divided into this. This is showing what we'll be doing for those who are going to be doing Hijama. You find out each month is broken down into modules too. Like I said, this course has weight. And you see this particular first month has 4 credits, 4 credit units. So we're looking at a number of hours and some practicals we will be doing and talking to you about it. And we will be recognizing prior learning experience. So every experience you have that is there would be taken into consideration while we're grading you, while we're discussing with you, and while we're assessing you. You see, the objective is to establish this first module we will do, where we'll be starting our first class for the first month, is partly to establish this understanding, and the students should be able to discuss it and give a definition of Hijama, why it is done the way it is done, how it came about, the little we know from some 3,000 to 4,000 years ago that has come in, and some of the ethics overview of it. Like I said, we'll be looking at this course in modules. You're seeing the modules for Hijama cupping therapy broken down here for those who are doing the combined course. So we're giving this that would be useful for both in this first class. This is the only class we'll be running through social media just to show and discuss. The rest of the classes would only be strictly for those who are in our classes and who have paid for the program. But we're sharing this so that people will understand what it's all about and how it is. So you can always reach us if you want to. You can send us a DM or a text. Now you find out we have module 1, which discusses about therapy, what it is about, to give you some explanation and understanding, while module 2 will tell you how it is performed and some more explanations. The benefits will come up. We're trying to build from down going up. By the time we get to module 4, we'll be going into body organs. The way the traditional medicine person looks at your body is different from the way the allopathic medicine person looks at your body. the way they see the organs, whether in traditional Chinese medicine or in our own traditional African medicine or any other traditional medicine, it's either yin yang, hot, cold, acidity, alkalinity, depending on where you are from. So why do they see the body like that? And how do they treat the body on temperament? Why are they not so interested in active ingredients and components that allopathic medicine is watching for? Okay, so, why are they like that? You'll understand all these parts of it. The temperamental theory would look at those points that you need to know on the body. And we would be, as we go further, we'll come to various coping techniques that are there. Then we will introduce you to diagnosis. This is one of the longer modules that takes time. Diagnosis, so that you will be able to know what is wrong with your patient. You see, the traditional medicine person, apart from being a doctor, he is a nurse, he is a lab, he's a pharmacist. Altogether, it's an all-in-one package, so to speak. So you find out you should be able to diagnose your patient without sending him or her to the lab. You should be able to know what herbs will treat this patient wherever you are. You don't have to go with the traditional medicine person. It's his own pharmacy, so he moves around. He sees plants at point A, point B, point C, and he picks it up. And so he's gotten that in place. So these we will teach as we go along. We'll teach you how to read other test results that your patient would come in. You'll find a patient might just come in and tell you he went and they told him he has lumbar spondylosis. This is the X-ray or this is the MRI. Or they said he has an infection, urinary tract or otherwise, and you should be able to read this. You are looking at fertility-related issues, and the lady comes in and says she has a fibroid or a cyst, and you want to see, you should be able to read that report that has been written and understand it, and that too, like I said, each module and each breakdown would have a test at the end of it, which you are expected to answer. Now, if you fail to answer your test, you fail to do your assignment, it will affect your graduation. We will not give you a certificate just because you paid and you attended some classes. You must do in and continue. There are some people who were going to add into this particular class now who have paid their assignments. So we're just putting them in so that they would now continue. They've indicated interest. And there are those who didn't complete their payments and did not to the end of the class. Those two would be joining you in this class. And Play Allah makes it easy for us, and the knowledge will be very beneficial. Now, we will now go to that performing, how we perform and how we do it, and then we'll be looking at case studies. That is where the practical is very important, because you can come in with your own patient. You will have to practice hijama on one of your colleagues or one of your fellow therapists. The therapist will practice on you, so you know how you adjust your hand. You want your patients to be happy and comfortable when they come, not to run away the way they see you. So, Hijama itself is highly rated worldwide as of now. And nobody knows when it started. But we all know that the Prophet ﷺ put a stamp on it and advised people to do it. And he had always told us that there's cure. If there's any cure in any of our treatments, it's in the blade or the needle of the Hajam. A Hajam is the person who practices Hijama, that you call him doctor. Then in honey and branding by fire, but he didn't like the fire part, but it's not forbidden. So you find out during the world wars or in the war front, you find out they treat wounds with fire. In fact, there's some cuts and bullet wounds that they would actually open up the bullet, pour in the gunpowder, put a fire there because it helps heal instantly. It's very painful. And if you choose to try it right on yourself first, so you know how it is before you do it on somebody else. So we're going to be looking at module 1, and we're going to go into copying therapy. We're going to just do parts of it today because this is the introductory class, and we are streaming this particular class. So we won't go too deep, but we'll take it up for the members of the class in the groups. You'll be getting your links for each lesson, and you'll be getting video recordings for each class. You can attend in class, like we have some people in class today. You can attend online. The recording will be given to you to watch and go over and revise, even if you had been in class online or in class offline. And the idea is you make your own notes. If you have questions, you make your questions and send into the group. Inshallah, we will answer them before each class. And if there's need, we would take it up as a whole class to answer those questions. There was a set that talked about the energy lines from Hijama, and we had to bring it back to TCM so that they will understand that these cups too are lined on those meridians of the body, especially the GB and the UB line. There are a lot of cups there, and you find out there's this point at the center of the head here, um, where it's called DU20 in traditional Chinese medicine. The hadith of Nabi Sallallahu Alaihi Wasallam says that point alone treats over 70 different ailments. And right now, science is ticking away and ticking away. And this is something from then, where there was no science like this. We're going to look at that, and we're going to discuss very briefly on that, and I'll answer any questions if there are. You see, cupping or hijama is a therapy where a cup is applied to the skin surface to cause a local congestion through negative pressure. That is why you have these cups. You can see various pictures there. The glass cups, what they call China standard now. You have copper cups. You have the horn. You have the most popular one now is the plastic cups. You have bamboo cups. You have China cups. Each one has its own use. You see, when you're doing cupping and you go into fire cupping, you'll understand that it has some special ways about it that brings slow pull, because it's as the cup cools that it goes. This applies to copper cups too, but copper cups have another edge because copper has some metaphysical value for treatment of patients. The horns and like that. So we'll look at all these things, whatever the cups is, you learn how you put it and what it is and what is good. So like they say, the medical translation of it is in therapeutic application. Hijama literally means to extract, withdraw, or restore the body's full fluid volume and tissue balance to its natural state by removing morbid humors. Now, this humors, we'll go into it when we take small electives for traditional medicine. Like I said, we'll look at the body on those temperaments. We'll get to understand the four humors and the temperaments. And that the Chinese have 5, others have 4, and like that, you'll understand how they work together and how they want how they go about the calculation treatments and like that. So, like I said, it is a medical procedure, you see, but a lot of people look at something that they could just go into because you can buy the cups and they saw his friend doing it, or he has a relative doing it, so he wants to do it. No, it's actually more than that. It is a science. So, like I said, we will be going into details. This first lecture today is to bring in an understanding, to set our ground rules, and to look at the ways we hope to go along with it. In trying to answer this regarding ground rules and how we run the lecture, I have looked at questions that have come up regarding attendance for people who might have in their clinics or who are in their offices or other places. If you cannot join in live, then of course you can come in and watch after the class. It will be into the group. For those who are in class, here they can ask more questions, they have more interactions. You see, the people with most advantage, those who are closest to any classroom. Once you're doing a program and you can attend the class physically, there is that special contact to it. Where you cannot, then as much as possible, follow it online. Keep to watching the videos. That's why we give you two videos, revise, make your notes, prepare your questions. And that will put you on that track to learn and to excel. So as far as timing is concerned, it's flexible. As far as payment is concerned, we expect and we look forward to full payment, but where the student, sorry, I keep saying patient, where the student looks towards a broken down payment, we prefer 2 part payment to make it easy for all of us. The classes will be taken not by only me, but by some other therapists we have in-house. Yes. IFA Holistic Healthcare is also an integral part of the development of the zero draft for the NSQF program level 1 to 5, set up by MBT. Shifa Holistic Healthcare is also an integral member for the development and critique of the diploma curriculum for ND and for HND as presented by National Board for Technical Education. So right now in the country, we've gone so far that we have these certifications that are available. So if you have a polytechnic or a university, you can get the curricula to run these programs. If you have prior learning, the NSQF is very, very important for you to key in, which is here. I don't know if there are any other questions, anybody online. There are some people on TikTok. Let me see if they have any questions. No, I don't have. Okay. Yes, the tests and the questions are very important. And at the end of it, there would be a kind of case study, like I said, which is more or less like a small project you would write, but you'll be given a title to explain what we want to assess what you really know, that you've really learned, the learning experience was there, and that we can beat our chests and say, yes, any patient that goes to you is in good hands, like that. So this is how this program is going to be. Try to attend in all. Where you're not in class physically and you're not in class online, we will monitor too and try to add in or add out. We understand that you can view all the videos from Telegram, which we're using Telegram because each time somebody joins, you don't have to resend. You can go back in and see what was there. But we can also tell from Telegram if you have watched the video or not. If you have not watched the video, then we will know and we will score you. Then we will also expect you to do your tests as and when due. We're trying to see where we'll get you some MCQ questions too as part of our test. We're going to be using different test instruments to test your knowledge because we want everybody to be top. There's another question here. How does one tell if he needs hijama or not? Now, as for hijama, basically there's a need. The reason is, as a sunnah, we are told that for every sunnah you come across, you should do it even if it was once in your lifetime. That once in your lifetime means you do it, and if you have an opportunity to do it again, but since we don't know when we'll die, so we do it. But then now on the medical part of it, you see, what does hijama do? Hijama detoxifies the body. It is nicknamed the kidney of the body, the external kidney of the body, actually. So the way your kidney tries to take out toxins, flush different things out of your body, that is what hijama does to your body. So it takes out toxins, it takes out dead blood and small debris of blood that ordinarily would have gone through your kidney or your liver, and sometimes it breaks down to your kidney. So you find people, you urinate and your urine is looking good, but maybe a little off in color, but you smell like blood there. And this is there. Where there is pain, where there is fatigue, you could do hijama. Where there's depression, where there is stagnation in the body, and so many things. This, as we go on, when you go into diagnostics, how to diagnose the patient, you would know not just that this person you need to put in hijama in the person's treatment, but which areas to put in. For those who do hijama on sunnah monthly, you find out that they are very fit. Most of those morning tiredness, those weaknesses, mental fatigue, and eases as they start off from the first month, second month, third month, fourth month. They don't miss out on those sunnah days. Some every 2 months, but you find out they stay fit and they don't get as sick as people who don't do it. So there's a lot we'll discuss further on that point. Now, another question that came in is regarding pregnant women. Pregnant women are contraindicated for so many things. Once a woman is pregnant, there are so many things you don't do. Hijama is one, acupuncture is another. In the hospitals, you don't just give her any injection anyhow. You don't do, there are so many things you don't do because you don't want to break the balance that could cause an abortion or miscarriage on the woman. The only time you would use hijama on a pregnant woman is during labor. When she's due and it's time to induce labor, you can put your cups in certain positions, but for that, you really have to have done that advanced course to understand the implications of it. But you don't do hijama on a pregnant woman at all. At all. Another question that came in regarding sihr or evil eye. Now, how do you cure ayn and how do you look at it? Ayn itself, there's the dua that is very popular. أعوذ بكلمات الله التامات من كل عين لما, and up to the end of it. That is one of them. قل هو الله أحد فلك الناس solves that to a great extent. But yes, hijama, there are certain points on the body where you can use to treat sihr and ayn. These points, you need to know them, understand them, and how to use them. This is like in this first diploma, we might breeze it since the question has come like this. Maybe some of you might see this, but do not be surprised that you're doing hijama for a patient and then the person goes into how will I put it, possession, when somebody is possessed by some spirit or so, or jinn or things like that. And so you need to know ruqyah that you can do. If you don't know the ruqyah fully, you need to know what emergency procedures you can do, and you should always have somebody who is specialized in those jinn-related things handy so that you can call the person and say, look, I have this problem here, and he or she would come and assist you, just like you're referring the case, but the case will be treated probably in your facility. So yes, there are points like that, and you might see stagnation there. Now, reading it, you'll be able to know what to do. But that in itself is one subtopic on it. We normally treat it in the advanced class very well, because that is where we break down the nitty-gritty of so many things. You know. Is there any other question? You have a question you want to ask?
Yes.
Good.
My question is, for children, do you do hijama on children, or is it only adults?
Yes, for children, not for infants. That is a very specialized case, except if there's something, but normally you would see a child that is from 2, 3 years old, and there must be a need. Most times you find out it will have to do with most ailments that come up that for those are chest related congestion things and so you want to, and in many cases it will be dry cupping. So it will be hijama, the gay shirt. So it's hijama, but you're not taking out blood. So that is in cupping therapy, they call it dry cupping. In hijama, as you are doing hijama, the gay shirt, because it's either wet or dry. So yes, you can, but it is not a first choice. Just like in allopathic medicine, it is not a first choice to give a child an injection. We see it here, they just give injections to everybody, but it should be your last resort. So if it's possible to do that, and so if there's no other question, we will be going offline, and we will send the link for class to those who are in our groups to follow and to be able to keep up to the class. And if there are any other questions, please send to the group. For those who have monitored us via Facebook or via TikTok, if you have questions or need for clarifications, just DM us or chat us. Inshallah, we will be willing to answer all questions as is. So we will be ending this session now, and inshallah.